46 years lady complains of severe left radicular pain for last 2 weeks. She had a similar attack 2 years before, 4 years before. Severe pain, limping, numbness, tingling, weakness. Conservative treatment is working, but this time it is severe pain and no conservative treatment. All conservative treatment fails. L3, L4 and L4-L5 huge disc, both the level left side nerve root compression, tingling, numbness, weakness. She developed some scoliosis and the incontinence of the bladder, urine. And now we are approaching the L4-L5 fast left approach. This is the L4 lamina, this is the L5 lamina, this is the spinous process and facet. We have just removed the bit of the ligamentum flavum. Now this is the SAP, supraarticular process of the L5 vertebra. This is L4, L5 level. And this is the hypertrophic portion. She is 46 years. Hypertrophic portions of the SAP. We are just trying to remove it, the medial hypertrophic portions of the SAP, so that the nerve root will be decompressed up to the foramen. And this is the foraminotomy. Pretty over there. This process, still 45 days. here. That L4 Jodi gets. So this is adherent. Definitely it is chronic. Maybe that attack of the 4 months before, that was the cause, and it is not relieving. Now it is aggravated for 2 weeks, but again the it is adherent. You can see this. This crystal. This crystal. इसलिए कटेड और प्राणी चश्मा पिंधु देखा टीवी उल्टा बोला उल्टा बोला उल्टा बोला Stop. Stop. ଏଇଟା ହେଲା ସ୍ପାଇନାଲ କର୍ଡ ଆପଣ ଦେଖୁଛନ୍ତି ଏଇଠୁ ବାହାରିଛି ନର୍ଭ ଏଇଟା ଗୋଡ଼କୁ ଯାଉଛି ଏଇଟା ତା ଦେହରେ ବାହାରିକି ଆସିକି ତାକୁ ଚିପୁଛି ତା ଦେହରେ ଜଡ଼ିକି ଅଛି ପୁରା ଏକଦମ ଛାଡ଼ୁନି ବୁଝିଲେ ଏଇଟା ଚାପିକି ମାରୁଛି ପେନ୍ ଏଠି ଅଛି ବାହାରି ଆସିକି ସେଇଟାକୁ ଚାପିକି ରଖିଛି ଏକଦମ ଆହୁରି ଖଣ୍ଡେ ଅଛି ବୁଝିପାରିଲେ କେଡ଼େ ବଡ଼ଟା ଏଇଟା ତାକୁ ଚିପୁଥିଲା ଆଉ ଚିପିକି ମାରୁଥିଲା ସେଥିପାଇଁ ପେନ୍ ହେଉଛି ଆଉ ଏଇଟା ପୁରା ଜଡ଼ିକି ଅଛି ଆଉ ଟିକେ ନା ୱେଟ୍ ଛାଡ଼ୁନି ତାକୁ ଛାଡ଼ିଲା ମାନେ ସେ ଅସୁବିଧା ବିପଦ calcified এটা হচ্ছে maybe the end plate ସେଥିପାଇଁ ସେଟା ବାହାରି ଆସିକି maybe that is the end plate small end plate adherent ourselves. Packing gauze piece हमें दे थे लोग दी साइड रे तଳେ ଉପରେ to protect the dora camera पे उत्तर धीरे से करना तो चूल्हा ଏବେ ଦେଖନ୍ତୁ ଏଇଟା ପଲ୍ସେସନ୍ ଆସିଗଲା ଦାଗ ଦାଗ ହେଉଛି ଦେଖିପାରିଲେ କ୍ଲିୟର ହେଇଗଲା ଏଇଟା ଲୁଜ୍ ବି ହେଇଗଲା ପଲ୍ସେସନ୍ ଆସିଗଲା ଏଇଟା ପୁରା ରିଲାକ୍ସ ହେଇଗଲା चलो थैंक यू चल कुछ नहीं ना कौन दे अब
लाइट ऑन करो रे प्रोफेशनल प्लेयर से पट्टी पड़ेगा
So 46 years lady complains of the severe left radicular pain for 2 weeks and similar attack 4 years before, 2 years before and 4 months before. She is now having severe pain, scoliosis, incontinence of the urine or urgency and weakness, numbness, tingling. And now there are 2 level discs 3, 4, 4, 5. 4, 5 already we have done, that was extruded and migrated bit upward and that we have removed, that was adherent also. We are approaching from the left side. So this is the L4-L5 level that we have already operated. This is L3-L4 level. This is the AT we have given, below that is the dora is visible. Now we are now approaching from the same port. So single port we are trying to operate 2 level disc herniation. This week also we have operated 1, 3, 4, 4, 5. So the same port we did the decompression of the bilateral 3, 4, 4, 5 left and right. So 2 level bilateral decompression. This is 2 level discectomy from the single port. Let's see if you succeed or not, otherwise you have to make a separate port sometime. Most of the time we are doing separate port, but if it is a short height lady, you can try the 2 level, but the patient we have operated 2 level bilateral lumbar canal decompression, that is a male patient and not short height. So everything possible if you can manage to manipulate the instrument. This is a mobile operating tube. So this is the beauty of that set, of Destendo set. So cranial we have detached the deep layer of the ligamentum flavum. This is the caudal layer, the caudal end of the flavum. I am just trying to demarcate, just to see the demarcation, the junction of the soft tissue to the bone. Here it is the inferior lamina. We will just trim a bit of the bone of the inferior lamina. The deep layer of the flavum is attached at the superior border of the lamina inferiorly. So most of the time it is not necessary to do the bony work, only trimming a bit of the bone or detach the flavum. So we are trying for that. And this is the foramen. So we have to remove a bit of the bone and the foramen and the roof of the foramen, so the foraminectomy and the nerve root will be exposed, completely decompressed up to the foramen. Now we'll put a petty here, one cranially and caudally to protect our dura. छोटा बड़ी रहेगी. Yes, 45. So this is the hypertrophic portions of the SAP. Here it is the L4 vertebra. So that has to be removed, only the medial aspect hypertrophic portion, so that the nerve root will be completely decompressed up to the foramen.
कुड़े करता
Actually, looks like very thick ligamentum flavum. Yes. This person. So flavum is very thick here in comparison to the other level. 45, 45. Another place. This person. Pretty. Pretty. Foramen is very tight here. Leaving the flavum was very thick and stout. Yeah. 45. This person. Residual bleeding. Residual vessel is engorged. Dilated. Spatula. Okay, this person. This person. Spatula. There is a vessel, epidural vessel. Yes, now putty. ಹೌದಾ ಬರಲ್ಲ ಮಾಡುವುದೇ ಫಸ್ಟ್ ನೋಡ ಸ್ಟ್ರೇಟ್ ಆಗಿ So now we got the disc, we got the nerve root, and this is just little bit of the bony work at the medial aspect of the aspect, so that we can have the good trajectory. That is dirty. Good trajectory. Tight is procedure is baron. Spatula, only cut it as सेशन 1 से सेशन 6 नाइट मेरे होप करें नाइट और दिस सेचुला पूरा हार्ट ओह अच्छे अच्छे एक्यूपमेंट का जाना पड़ा दिस पर्सन 30 इधर एक एक्सट्रूडेड है दिस पर्सन टेबल डिलीट करो अपोजिट again how the disk person spatula everybody then it is a paracentral disc almost like a midline it's like a midline disc paracentral disc चलो spatula yes Nelu photo Nelu yes that is the cause that is the paracentral extruded disc spatula extruded this space, so it is extruded and upward migrated. It was there, but it is removed now. Good. Then I can. This person. Yes. So this is the content part of the disc. Not so much. But this is the paracentral disc, which was extruded and migrated. That was removed. And that was adherent also. This is also. Yes. So due to the mobility, the mobile operating system, it is possible, otherwise it is difficult to operate on the single port. Now we will irrigate the disk space. With the normal saline and gentamicin, and we will see if there is 3 fragments left out in the space. So nothing is inside spatula. Yes, everything is free. Inside it looks free. No more free fragments, nothing. And the extruded part was here. That is also free. Extruded part is here. So this person, this person है camera approach. Outside picture video ने photo ने outside picture camera approach. लाइट टिके ऑन कर दे. रूम लाइट ऑन कर दे. एडा बंद कर. रूम लाइट दे.
लाइट ऑफ करो. टॉप लाइट ऑन करो. रूम लाइट
देखा जीव ना रूम लाइट हेडलाइट दब. ये गोटे पुट्र हूँ गोटे आउ गोटे गोटे आउ कौटी कौटी किसी कणा कराई देखा पड़े से
लाइट टिके देख देखो.
The spatula. So now you see this from the single port. Right, the one ठीक है जी. Single port only we have operated the 2 level disc. It is L3, L4 and L4-L5. Now see the camera. This is the L3 lamina. This is the L4 lamina. We have done the discectomy here, and that was extruded and migrated upward. The disc was here. This was the place. It is the paracentral extruded migrated upward disc, and this is the content area. We have removed the 3 fragments. This is my nerve root of L3, L4 level. That means L4 nerve root, and this is the bony bridge intact. This is the L5. So this is the L4. This is the L5, and this is the L3. So both the level we have operated from the single port. This is the nerve root here at L5, L4, L5. So L5 nerve root. the piece was extruded and migrated the disc space from the disc space, and it was here. That was a space. 1 second. I'll just clean this area. My surgery cell is there to stop or maintain the hemostasis. This is the area again. This is the paracentral area where the huge disc was sitting. We just removed it very nicely, decompressed and removed both the level. Discectomy done. This is the nerve root of the L4, nerve root of the L5, and the two level was operated from the single port. Thank you. Was there. Section sir. Observe. This person. This is the amount of the disc we have removed, maybe around 2 to 3 gram. Thank you.